Hi, my name is Rashma and welcome back to my channel where we discuss everything occupation therapy and sexuality related. In today's video, we will be covering sexual health with the geriatric population. Talking about sexual health is very important with your clients, especially since sexual health can play a role or affect other parts of your health. So let's talk about STDs, sexually transmitted diseases, which can spread during unsafe sexual activity, which include but are not limited to gonorrhea, syphilis, and chlamydia. And these are just some of the STDs that are spiking in nursing homes. Yes, spiking in nursing homes. I bet you would have never thought to put those two together. In a recent study, it was shown that between 2010 and 2014, in adults over the age of 65 years old, gonorrhea cases have increased by more than 90%. And syphilis and chlamydia infections each have increased by 65% and 52%. That's a pretty big jump. So, this is where education really comes into play. For example, I've also noticed, or studies and research have done, that women who have went through menopause don't really tend to worry about pregnancy. So they just feel like practicing safe sex or using condoms is just not necessary for them. And that's mainly due to the fact that education of safe sex was not really a popular thing back then as it is in comparison to now. So this elderly population is really just not educated in it. Overall, what I've noticed is older adults have an increased risk of contracting STDs due to a lack of knowledge and education on safe sex, health problems because they are a vulnerable population and they're more immune compromised and more susceptible to getting STDs, and an increased availability of drugs for sexual issues are all reasons that we should really start focusing on sexual health education to our clients. These are just some tips that I have that I encourage you to talk to your clients about. The very first one is the use of contraceptives. So, using contraceptives when engaging sexual activity, like condoms, kind of help create a barrier that helps minimizes their chances of getting STDs. This comes from that education because, as I just mentioned earlier, women are more willing to not use condoms while participating in sexual activity because they feel like they're not going to get pregnant anymore. However, it goes way beyond that. The second one is to communicate. So encourage your clients to be open about their sexual health history with their partners so they can keep themselves safe as well as keeping their partners safe. And the very last one is to get tested. It's very essential to get tested for STDs, even if you only have one partner or are even using contraceptives. So aside from STDs, these are just a list of other sexual concerns within the elderly population. The first one being lack of interest or anxiety that interferes with sex. For example, it is known that women are more likely to have lack of or reported lack of interest, and that's mainly I feel like due to the societal pressure that doesn't really encourage women to explore sexuality and anxiety that interferes with sex. This could be a result from anything, especially with things like fatiguing conditions where an individual may have had a heart attack and they are trying to re-engage in sexual activity with their partner, but they just feel like they can't because if they were trying, they can't engage in sex because, hey, if I do this, then I may have another heart attack, and that fear is really holding them back. Another one is erectile dysfunction, which is very common with males, and there are medications for this. There's difficulty with the vaginal lubrication, so as females get older, vaginal dryness is common, which again, there is therapy for this. Inability to reach an orgasm, lack of pleasure, reduced sensations, even pain during sexual activity. And pain can be due to things like arthritis or any type of orthopedic conditions. As you get older, things start to hurt more. And even like UTIs, for example, you can have pain during that. And that can easily have been avoided if an individual received proper sex education and a sexual health education to avoid that. So, in conclusion, I really encourage you, all healthcare professionals, future healthcare professionals, to get educated in sexual health, especially sexual health in geriatrics if you are working in SNF, because that's what helps prevent these diseases among these older adults. Something simple as having a conversation can prevent many of the risks involved in sexual health of seniors. So, really encourage you guys to do that, as well as I have linked a link below on the video, below the video, and it's all called healthandaging.org, and it's basically a site where you can learn a lot more on sexual health and the geriatric population. So I really encourage you guys to all go check it out and really educate yourself so you guys can better help your clients. So until next time,